I would tell my colleague that surgical site infections are actually the most difficult complications to treat. Hi, my name is Antonia Chen. I'm a hip and knee arthroplasty specialist and orthopedic surgeon here at Brigham and Women's Hospital, where I'm director of research. I'm also an associate professor at Harvard Medical School. As a hip and knee surgeon, unfortunately, I encounter surgical site infections or periprosthetic joint infections pretty regularly. Surgical site infections affect not only patients, but their caregivers and family members as well. It can affect their morbidity, meaning their side effects from medications, not being able to walk, and then having to take time off of work. Caregivers and family members also have to take time off of work, so that's a financial toll and an emotional toll as well. And finally, the risk of surgical site infection is that it increases the risk of death. Patients with surgical site infections, unfortunately, are predisposed to repeat surgical site infections. What happens is once you become infected, bacteria can actually stay there. We have to either prevent the infection from happening the first time or eradicate the infection as much as possible during the first treatment. Discussing surgical site infections is a hard topic, especially for surgeons, because they feel like they failed. They feel like they did a bad job and they let the patient down. But in honesty, there's a lot of other risk factors involved with surgical site infections. The goal is to open up discussions so that we can improve the treatment of our patients from these devastating complications. There's no holy grail when it comes to preventing surgical site infections, but we need to do everything in our control possible to reduce the risk of surgical site infections. For prevention of infection, we want to start with the preoperative area, where I want to optimize my patients prior to surgery. What can I modify as a surgeon to make my patient better? Secondly, what can I do as a surgeon during surgery to try to improve my patients? This is where the Ethicon advanced wound closure products have been fantastic that I've used in my own surgical cases. I like to be able to seal the wound completely to prevent bacteria from entering the wound, and by using so, I use Stratifix on all my fascia closures. I also like to use antibacterial sutures, and that also decreases the risk of infection as well. And finally, Prineo is an option for patients to be able to seal the wound completely to prevent bacteria from getting in and for allowing the wound to heal appropriately. I don't like to change things frequently, but I do change if I know it's going to improve my patient's outcome. I remember using wound closure products such as interrupted sutures and found that my peers were using things like Stratifix, and it sealed the wound entirely. So I started using that in practice, and I'm very happy with the results there. As surgeons, we are empowered to make change. We can take things into our own hands and take control of them and make them better. My goal as a surgeon is to make surgical site infections a never event. We want to have 0 surgical site infections after total hip and total knee replacements, and we can work together to make that a reality, because even 1 surgical site infection is 1 too many. 0 starts with 1.